Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. I hope everyone had a wonderful summer, and I hope the great weather continues. But Labor Day and a return to school is a sign that fall is coming, something we've been preparing for many months. This is our third fall season with COVID-19, and as much as we hope that things will return to normal, we know that they're still anything but normal in many ways. While our wastewater signal has decreased somewhat from the peak of the seventh wave, it has not decreased to where we had hoped it would be by now, or as low as it had been following previous peaks. This means that there are still relatively high levels of transmission in the community. We also know that in York Region and in Ontario, levels of hospitalizations due to COVID-19 remain persistently high, continuing to strain our acute care system. Deaths also continue to occur with unfortunate but steady regularity. I'm hopeful that each of these metrics will continue to decrease over the coming weeks. Unfortunately, starting the fall wave at these relatively high levels of transmission and hospitalization is far from ideal. Whether it's COVID-19 or other respiratory viruses, it may be a difficult fall. In fact, we've already seen several multi-pathogen outbreaks in some of our York Region facilities. That is, COVID-19 infecting individuals along with other viruses such as metapneumovirus and other seasonal coronaviruses. Fortunately, these outbreaks have not led to severe illness for the most part, thanks to an overwhelmingly vaccinated population. We can continue to work towards as normal a fall and winter as possible by building on these successes, particularly with vaccination. The bivalent vaccine that protects against the original COVID-19 as well as the Omicron strain was authorized by Health Canada on September 1st, and we look forward to making this vaccine available to York Region residents very shortly. We expect the bivalent vaccine rollout to start with those who are older or most vulnerable and quickly progress. Even if you haven't had one or both of your boosters yet, it's important that you have the protection afforded by this bivalent vaccine. So please get vaccinated as soon as you are eligible. More details will be available shortly. Another change on the vaccine front is new eligibility for boosters for children 5 to 11 years old. While children in the US and elsewhere have had access to boosters for some time, this change happened last week in Ontario, just in time for a return to the new school year. This booster is recommended at a 6-month interval after the second dose. Boosters for 5 to 11-year-olds are currently available by appointment only, so if you've not booked a spot, please do so now, as this is the best defense for children to remain protected as they attend class. You can find a clinic near you at york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675. New appointments are released regularly, or you can also book through the provincial booking portal if you're having trouble finding an appointment. Anyone 12 and over who requires a first, second, third, or fourth dose can walk into a York Region Public Health Clinic. Children 6 months to 5 years still require appointments. Another recent change is the new provincial guidance regarding isolation. Remember, you are still encouraged to remain home if you have any COVID-19 symptoms. This includes waiting until your fever is gone and your symptoms are improving for at least 24 hours or 48 hours if you've had nausea, vomiting, or diarrhea. This reduces the exposure of anyone else to the virus and helps limit overall spread in the community. Once you have passed the 24-hour mark with no symptoms, it's important that you wear a mask for 10 days and avoid non-essential visits to high-risk settings like hospitals or long-term care facilities. More details on this can be found at york.ca/COVID-19 positive. This mask guidance also applies to those in schools, where it's important to protect from COVID as well as other illnesses. Please be mask friendly yourself and encourage that approach with your children. Do keep children home if they are symptomatic, even if their illness is not due to COVID, just as you would have prior to COVID. You can find a screening tool at york.ca/safe@school that you can complete daily before sending your kids to school or childcare. Many of you will also have heard about the recent aconite toxin exposure in York Region. I mention it here because while it's not COVID related, it speaks to the incredible work that our public health colleagues do every day. Our teams did an amazing job and incredibly fast work in identifying the offending contaminant, removing it from shelves, communicating with provincial and federal partners, and protecting the public from harm. I'm so proud of everything our public health teams are doing, both in COVID and non-COVID work. I'm wishing everyone a safe return to school and assuring you that we'll continue working together to keep our communities safe and healthy.